Who's ready to go in the club? But before we do, to head on in there to Costco to check out the skincare, give this video a thumbs up if you like skincare content from a board-certified dermatologist. Make sure you're subscribed and you have your bell notifications on so you know when these videos go live. I know how much you... I don't know who that person was honking at. I guess they wanted to be in the video. I know how much you guys love these videos. So yeah, make sure you give this one a thumbs up. It's been a while since I've been in Costco, about a month. So last time I came here, I tried out a moisturizer that I am still using as a little update. Caffeine one, that's kind of like a Brazilian boom boom cream. Has a light almond scent. So if you missed that one, check it out, but let's head on in there. Costco pranked me. They moved all of their skincare, body care products to the center. I went back over by the pharmacy where it used to be and I was like, whoa, what happened to all of the skincare products? Anyways, they got in some new hand wash by the brand Method, this gel hand wash. Now, here's the thing, as we get into the winter months, dry hands are more likely to be a problem and you're gonna be washing your hands a lot more. With cold and flu season coming up, I mean, you should be washing your hands anyway, but with frequent hand washing comes an increase in dry hands, and if you deal with dyshydrotic hand eczema, otherwise known as pompholox dyshidrosis, it's very, very itchy. These little water blisters that appear on the sides of the fingers are like firm, almost look like tapioca beads, and then they start leaking fluid, super, super itchy. Actually, contact with like nickel is a frequent trigger, but if you are in a bout of frequent hand washing, that likewise can set it off. So the key to combating dry hands related to hand washing or really anything is to grease up your hands as frequently as possible with a thick ointment like Vaseline or Aquaphor. And they sell these little white cotton gloves. You can get them at the drugstore. And the best thing is if you put like Vaseline or any kind of ointment, Aquaphor, your ointment of preference, put them on the hands and put those little white cotton gloves on like at nighttime and hang out as long as you can tolerate. You could even sleep with the gloves on and that will really help you to heal that bout of hand eczema. Another risk factor for hand eczema is if you sweat a lot. If you have hyperhidrosis, meaning sweaty palms, the sweat is an irritant on the skin and it leads to more water loss, dries out the hands, flares the hand eczema. So in that case, you know, if it's really bad, Botox injections can actually nip that in the bud. I'm so happy to see this here. Remember, I used to come in here all the time and be like, I wish Costco would get in the Hydro Boost Gel Cream fragrance free. And it's like they've been listening to me and it's currently, is it currently on sale? Oh no, it's not. This 2-pack is $28.99. This is one of my favorite skincare products. Oh, look who it is, the EOS All Day Moisture. I remember when this was so popular in the early 2000s, and then people developed cheilitis, as can often happen with pretty much any lip balm. But because this was so popular, issues with this product were then, as a result, more common. And so it kind of got, you know, typecast as problematic, if you will. But in reality, that type of problem can happen with pretty much any lip balm because the flavorants in these things can be pretty irritating. People like lick their lips a lot too, and those two things together can really lead to a pretty stubborn lip lickers dermatitis. And it's kind of a cyclical thing because you put this on, it feels nice, it's soothing, and then later on the flavorants dry out your lips, cause irritation, you lick them, it just kind of feeds a vicious cycle where you then put more of this on. Speaking of hand hygiene, we have good old soft soap. What a value. You get these two massive jugs. What's the volume on these? 2 80-ounce bottles for $9.99. That is 6 cents an ounce. Cocamidopropylbutane is a mild surfactant. It's what's in tear-free shampoos. This does have fragrance, which can be irritating, although in rinse-off products, it's less likely to cause issues unless you are allergic to it. If you have dyshydrotic hand eczema, you're more vulnerable to developing allergies to things that come in contact with the hands, just as a note. When it comes to hand soaps, though, and hand hygiene, honestly, it's more about the duration of time. Like, you're supposed to sing the alphabet. That gets you a good amount of time. You want to make sure you get that lather on all surfaces of the hands, between the fingers and around the nails. People often forget to get the backs of the hands. It's one of the most frequently skipped area yeah, people focus on their palms, but they forget like between their fingers and the sides of their fingers and around their nails. So good hand washing has revolutionized infectious disease transmission for sure. I mean, it's such a simple thing. So this doesn't really have anything to do with skincare, but I'm going to put a plug in for oral care, as I often do, because everybody give this video a thumbs up. I just had my dental checkup and I don't have any cavities. Woohoo! So thumbs up for me. But all that to say, do not neglect getting your teeth cleaned. You're supposed to get them cleaned twice a year or every 6 months, and visit your dentist. I know in these times it can be seemingly cost prohibitive, so a tip I have for you is to look into your, if you have a dental school in your area, or even a dental hygiene program, often will likewise do this. They'll often offer free or discounted cleaning. So if you were in a bind financially, and you feel like, oh, there's no way I can afford to go to the dentist, do not give up. You don't want to neglect your teeth because it can have serious health consequences. And I'm not a dentist, so correct me if I'm wrong, but I remember, at least when I was living in New York, this was the case. The dental students, they had to find people. This is crazy. They had to find people to do their exams on, like for their licensing exams. Like they had to find patients, like solicit patients to come, and for their exam they had to do, you know, show that they could do, I don't know, like a filling or whatever. So they had to find people, random people, who needed a filling. So that's another thing to look out for. Sometimes these dental students, they'll put out like ads or whatever. So keep your eyes peeled for that. Check on, like, I don't know, if you use the neighborhood app next door, sometimes they'll go on there and be like, I'm looking for somebody. So yeah, talk around. Don't give up on your teeth. All right, looks like Olay Total Effects SPF 15 fragrance free is markedly discounted, $10 off. Previously was $33.99. It's now $23.99. This is a product. Okay, so the SPF 15. Technically that should be more than enough, but unfortunately the way in which people apply sunscreen is a tad too underhanded, so they don't ever achieve that SPF. So we recommend 30 or higher. But what is the SPF in this? Is it a chemical sunscreen? Yeah. So this might burn a little bit around the eyes. This also has niacinamide, which can help with the moisture barrier. It's also helpful for oiliness and hyperpigmentation, as well as redness. The tea leaf extract may also help reduce oxidative stress upon exposure to environmental stressors, along with the niacinamide. 25% more hyaluronic acid. I think I've talked about this micro-sculpting cream before, but a point about the hyaluronic acid, it can enhance penetration of things. For example, it can enhance the penetration of glycolic acid into the skin, which may be a good thing, may be a bad thing. With enhanced penetration does come increased risk of irritancy. So if you're using like serums and stuff and heaping on the hyaluronic acid, that could be a reason why you're developing irritation to products. Y'all know I love hyaluronic acid. I don't have any problem with it. I find that it's effective as a humectant, and it can temporarily improve the look of fine lines just by pulling water into the top layers of the skin. It's a good ingredient. I do think it knocks on the door of problems, we'll say, in the skin. I've talked about this product before. Man, they don't have much new in here, but let's remind ourselves what the form of vitamin C is in this. Oh, 3-O-ethyl ascorbic acid. It's one of the lesser than vitamin C forms, but it may help if you have hyperpigmentation. It may help in fading that, along with the lactic acid. That's going to help soften and exfoliate the skin, and then the niacinamide. Unfortunately, this does have fragrance, which can be, as I point out all the time, it can be irritating. This is now on sale, you guys. It's $12.50 off. $33.99 for these two serums. So that's not too bad. It used to be $46.49. I wonder if these are on sale too. These are a little bit more on the thick side. Alright, I came back to the pharmacy section and they have Vick's Vaporub here, which is new. And the reason I'm pointing this out is somebody reminded me that I pointed this out in another video and it helped them. And I got a lot of questions under that person's comment, like, I don't remember her saying that. So Vick's Vaporub, is funnily even a word? Probably not. Vick's Vaporub actually has been shown to help with toenail fungus, as odd as it sounds. And one of you commented the other day that you have been trying it and you've noticed improvement, which is great. Vaporub, the ingredients in it, you certainly can become allergic to, but I mean, who hasn't slathered their chest in this when they have been sick? Anyways, it has menthol in it, which gives a tingle to the skin, also can help numb the sensation of itch. So there's that. I mean, menthol is like what's in Sarna anti-itch lotion. $11.49 for the two of them. Nasacort. I'm actually glad they have this here. So this is popular for nasal allergies. It is triamcinolone, which is a steroid. Suppresses the inflammatory response. However, a word of warning about this, it can be a causative factor in the development of periorificial dermatitis, which is like an acne-looking breakout. It can happen around the nose. It's often referred to as perioral dermatitis because it notoriously occurs around the mouth. It's actually more closely related to rosacea. Basically, your skin develops hypersensitivity to things that come in contact with it. In addition, you get these little bumps. And it can burn, sting, tingle. Skincare products become very uncomfortable. And it's just very difficult to treat and to clear up. You've got to stop using the steroids, which are causative. And one thing people will notice is that their symptoms actually improve while they're using the steroid. So they think that that's what's helping, but in reality it's causative. And as soon as they stop, they get this rebound worsening. So stopping the steroid, which in this case is triamcinolone, is key. And then when it comes to the skin treatment, sometimes just a trial of like zero skincare is indicated because a lot of skincare products can end up aggravating it, especially if they're very heavy or occlusive. Seasonal allergies are a pain. Comment below and if you have them. I don't know what the incidence of allergic rhinitis is, but I'm feeling as though it's got to be like 100% in the city of Houston. I mean, if you live here and you don't have allergic rhinitis, there's so many mold spores and things, but this can be a contributing factor to the exacerbation and appearance of dark under eye circles because you're rubbing your eyes. That leads to inflammation around the eyes. Fluid accumulation can really bring out those shadows and dark coloration under the eyes. Fluid starts to leak. Inflammatory mediators that it's not actual pigment, it's just breakdown of like blood that leads to a dark discoloration. So staying consistent with antihistamines can help reduce that. Also, it will help with eczema if seasonal allergies are a trigger for your eczema, which they can be. Now, levocetirizine is non-sedating. You also have loratadine, which is also good. Benadryl is useless for seasonal allergies because it's very short acting and it's sedating. So Benadryl is more to sedate you. It's not particularly beneficial for seasonal allergies. Zyrtec is cetirizine. Then you have Allertec, the Costco version, which honestly there's no reason for you to pay the upcharge for the brand name on these. The generics, the Costco brand, the Kirkland brand is just as good. Allertec is on sale, $11.89. We've been getting a lot of rain right now, so the allergens are high. And then you have Allegra or fexofenadine. This likewise is non-sedating. Flonase is fluticasone. This is another nasal steroid, so be careful when it comes to periorificial dermatitis. This can be one that sets that off. I mean, if you need it for, if you've been advised to use it for allergic rhinitis, then don't avoid it, but be aware that that can be a negative side effect. All right, these are really popular. These bromonidine drops by Lumify reduce redness. You see, chronic dry eyes are really common. issue for people, more common as you get into your wiser years, because the oil glands in the eyes, they start to drop out. You start to lose them. You don't have as many oil glands. They're called meibomian glands. And also that can be influenced like around menopause. And as a result, your eyes, they may make more blood vessels and become red. So people like these for cosmetic reasons because they reduce the redness. Now, bromonidine, interestingly enough, applied topically is also a treatment for the redness of rosacea. However, an issue with using it for rosacea that can happen is that you can get actual rebound redness. So you stop it and the redness just like comes back with a vengeance. To what extent that happens in the eyes, though, I'm not sure. It's always been a concern I've had, but I checked the ophthalmology literature, and it looks as though it's not an issue with the Lumify drops, the rebound worsening of eye redness. Check with your ophthalmologist, though, before using these. Another concern, though, that I do have with these is that the ingredient, benzalkonium chloride, the preservative in these, that by itself is can cause dry eyes, can lead to dry eyes, because it disrupts your tear film. So there's that. That's an issue with drops like this. Like, it'd be great if they could make these preservative-free, although I don't know that they could, because they probably need the preservatives in there for the bromonidine. Speaking of preservative-free, if you do have dry eyes, these are the preservative-free eye drops. They have them here. I think I talked about these in Walmart recently, but you can get the little individual use vials, $21.49 for 100 of them. That's not too bad. This is especially useful if you're going to be going on Accutane, otherwise known as isotretinoin, because it will lead to dry eyes. Again, not an ophthalmologist, but when I was doing a deep dive into dry eyes and researching it, I was reading the ophthalmology literature, and it does look like lutein and zeaxanthin do show promise for dry eyes, but always discuss supplements with your physician, because one issue with these, they're antioxidants, and there is some research to suggest that dietary antioxidant supplements may actually increase at least lung cancer in smokers. So definitely talk to your doctor to make sure this is right for you. Here we have Band-Aids, 198, $13.99. Earlier we were talking about the steroid in the nasal spray as potentially causative of periorificial dermatitis, like around the nose and mouth. But also steroid creams, don't use these on the face unless you've been instructed to by your doctor, because you can put yourself at risk for steroid rosacea and or perioral dermatitis, which is related. They have the Minoxidil Foam here, $49.99. See, Minoxidil, your hair follicle has to convert it to the active form. Some people, it's thought, lack the enzyme to do that, and that's why it's not effective. But for other people, they get decent results, and some people get better results when combined with low-level laser therapy. I have a lot of videos on Minoxidil, but the thing about it is, like, you have to keep using it in order to maintain the results. And some people are cool with that. Like, they like the results that they get with it, and they don't mind continuing to use it. Other people are like, what? No way. I'm not keeping up with this. Goodbye. And that's the end of that. I was hoping they had cotton gloves here, but they have the nitrile ones. Here are the B12 supplements. Now, a lot of people find that B12, high doses of B12, actually trigger acne-like breakouts for them. But the sneaky thing about B12 is that a lot of energy drinks and things put high amounts of B12 in. So if you happen to be taking a supplement and you're consuming these things, then it's, you know, feasible that you are getting to high levels, and it could end up being the kind of thing that aggravates your acne. Why that happens, we don't really know. There's some theories. Well, guys, we got in quite a bit of fun footage in Costco, per usual, although they threw me for a loop reorganizing everything. I mean, they're always like changing up the layout in there, but they typically keep like the skincare and pharmacy stuff all together, so throwing it out in the middle of the aisle just, I don't know, threw me for a ringer. But I hope you guys enjoyed this video. On the inside, I'm going to put my more recent Costco Shop With Me video if you want to see that moisturizer, although it doesn't appear to be in stock anymore, at least at this one. Anyways, if you guys enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye!